and also introduce, or perhaps do as much as we can on anti-Parkinsonism. We had moved quite well, and we had looked. Well, I have this one's going to the side. We've done quite well. We had looked. We had looked at the 4-phenylpiperidines, and we looked at the different types of the 4-phenylpiperidines. We looked at the kawaida ones where we had meperidine, and then we looked at the ones which had the hydroxyl group, which we call the BEMI, like the BEMI ketone and the BEMI derivatives. We looked at the ones which had hydroxyl group at para position at the hydroxyl group, sorry, at the phenyl group, sorry, the ones which had a hydroxyl group at the phenyl group, like like the bemidone, it is at the meta position, sorry, ketobemidone, and we call them the BEMIs, and we say they have hydroxyl group. Then we had also the prodines, which had a reverse ester and also had a 3-methyl group, which he said was responsible for stereochemical changes, with, of course, the beta proteins having much higher activity than the alpha proteins. And of course, this is just because, as we said last time, that the addition of a methyl group orients all of influences the shape and arrangement of the ultimate molecule, and the molecule or the shape that fits best, whereby the benzene takes the axial position, is usually the beta proteins. And of course, we did mention that they have the reverse ester also. We say the reverse ester does is a bit stable to hydrolysis, but it also introduces some instability in that that group, it brings about a group that readily leaves to give us a toxic molecule. So we had gone through all that, and then also we went to the propyl, the 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 other group. We went to the other group after that, which was the propyl piperidines. Because we also mentioned the anilidopiperidines before I forget, and then anilidopiperidines are like the fentanyls, and these we say they are used as general anesthetics. And we did mention that the introduction of a nitrogen between the introduction of that nitrogen between the piperidine and the piperidine group and the phenyl ring allows again that molecule to orientate itself properly, such that you get the optimal molecule again where the phenyl ring has the axial orientation and where it actually fits the receptor very well. So with under the 4-phenylpiperidines, we had those different categories of drugs. Of course, we also had the analalidine, whereby you do have an ethyl phenyl group at position 1 of the piperidine ring. So we did look at those different groups, and of course, we did mention this SAR. So I hope by now we can be able to master the same. Then we also looked at the phenylpropylamines, and of course we did say the phenylpropylamines. Of course, we have methadone as prototype, and we said even from the name methadone, you can't tell it has a ketone. So we did mention methadone, which has a ketone, and we said, of course, in the phenylpropylamines, it is opening up the piperidine ring. Now you open up the piperidine ring, but you maintain the same groups which are necessary to bind the opioid receptor. We talked about the stereochemistry of the propyl amino chain, propyl amine chain, the propyl amine chain. We talked about the stereochemistry, where we did mention that you can have an alpha methyl group, either alpha or beta to the nitrogen. And indeed, we did mention when it is in the beta position, the resultant drugs are more active than when it is in alpha position. Then, of course, we also introduced the propoxyphene, and definitely we also say the propoxyphene has in place of the 2 phenyl rings, which are important for the shape and structure or shape of the phenylpropylamine, so that they fit the receptor. you have one of those phenyl rings replaced with a benzyl ring. And because of that replacement with a benzyl ring, then again, you lose the optimal shape. You lose the optimal size that is necessary to bind the opioid receptor maximally. And therefore, you find that propoxyphene has much lower activity. Not only do we have the propoxyphene having a benzyl ring, we also noted that in place of the ketone that is found in the phenylpropylamines, it has an ester. It has a reverse ester. The reverse ester, of course, brings in stability, but of course, that drug, of course, being an ester as opposed to a ketone, will have be more readily hydrolyzed, and therefore, also have much lower activity compared to methadone. Of course, we did also mention the fact that the introduction of a phenyl ring introduces chirality, and as we mentioned, the dextropropoxyphene, we did mention that the dextropropoxyphene will have, and this is our structure there, it has two Cairo centers. And when I looked at it, I think they're counting from here 1, 2, 3. So it has that Cairo center, which is number 2. For the purpose of the stereochemistry, we are calling it number 2. Let me get the pointer. So we have, as I've said, I think they're calling that number 1, and then this number 2. So that number 2, you can see it is a Cairo center because this is a benzyl ring, and that is a phenyl ring. In other drugs, like if you look at levomethadil, this is a benzene ring, that's a benzene ring, so that's not a Cairo center. But in propoxyphene, due to the fact that that is a benzyl ring, which is different from the phenyl ring, that's a Cairo center, and that's also a Cairo center, because of course that Cairo center has 1, 2, 3, and a hydrogen, and therefore you find propoxyphene will have 2 Cairo centers, and therefore have 4 isomers. But as we said, that the dextro isomer is the one which has more activity than the levo isomer. And as we say, the dextro isomer is the 2s 3r, as opposed to the levo isomer 2r 3s has much lower activity. And indeed, the levo isomer is used as an antitussive, whereas dextro propoxyphene is indeed in even preparations, is found in analgesic preparations for analgesic activity. Of course, advantage, the lower the analgesic activity, also the lower the toxicity. So its toxicity profile is, of course, much better than most of the other narcotic analgesics. You were also mentioning, I think the last one you were looking at is levomethadil, and I had to look, and I looked at it again. I understood why they are talking about acylating, but what you have to do first is you look at this levomethadil. I can't enlarge it any further. See whether I can enlarge it any further. Yeah, when you look at this levomethadil, I believe all of us can see it. The methadone, when you have the methadone structure, it has, of course, that group there as the methadone, and then the methadone structure has a ketone, so it will have here, this group here, cut it here, this will be a double bond for methadone. This will be a double bond, so of course this group will not be there. So this will be a ketone, CH2 CH3 for methadone. So why they are calling it that it is acetylated alcohol is because when you reduce the ketone, this ketone of methadone, you will get an alcohol. So you first of all, what they are doing is cleaving that, changing this to an alcohol through reduction. And once you get the alcohol, then you acetylate the alcohol. So that's what we are talking about. We are acetylating the alcohol, but first of all, of course, the alcohol of methadone, whereby this ketone, you reduce it to an alcohol, and then you acetylate that group, and you get the levomethadil acetate. You get the levomethadil acetate. I hope that is clear now. So that's what we are saying, acetylating the alcohol, but it's acetylating the alcohol of methadone. And then once you acetylate, you get a more potent analgesic. The resulting compound is a more potent analgesic, and the laboratory isomer is marketed as levomethadone acetate. A single dose can suppress withdrawal for 3 days and is used in the rehabilitation program. The levoisomer is 5 times more potent than the dextroisomer. So what we are seeing with these compounds is that there can be a change in the stereochemical requirements. There can be a change in the stereochemical requirements. And you look at the propoxyphene, we are saying the dextroisomer is more active. When you look at levomethadone, we are saying it is a levoisomer. When you look at morphine, it's a levoisomer. When you look at levofenone, it is a levoisomer. So occasionally, it's important to understand that you can have a change in the isomerism and still have activity. And that one we have been given by propoxyphene because we are saying it's a dextroisomer that has some analgesic activity, of course, not comparable to either codeine or methadone, but it does have some good activity. And indeed, when you go out there again, most of these drugs we are learning, try to check whether you can see them in formulation. You will be able to see dextropropoxyphene as a component or a constituent of quite a number of the drug preparations. So that I think this is just at least finalizing. Then, and this is now the optical activity of the dextropropoxyphene. So you can see that, as we are saying, that is a benzyl ring, that is a phenyl ring, and we are considering that this position here is 2s and 3r, 2s, 3r, to give us a dextro activity, and that is a group that do show us activity. Again, of course, of importance, of which I had forgotten, is that even to reduce the activity further, you can see the alpha methyl group is at beta position, not here. This is the alpha position. So again, that further decreases activity. As you have seen, you can see it is actually an ester and not a ketone. And we did mention that it is usually, marketed as where is that now? It is marketed as the napsylate. It's marketed as a napsylate salt, and we did say because this is water insoluble and therefore minimizes its abuse. And this is a propoxyphene napsylate. You can see the napsylate from naphthyl, so that you can see napsylate from naphthyl. It's a naphthyl sulfate. So we call it napsylate. Then another compound that has been derivatized, but a bit different. Again, it's a synthetic product having structural similarities to the phenylpropyl amines, but also structural differences. Is tapentadol. Tapentadol, if you look at it, it has that phenyl group, but you can see it has only one. And you remember we did mention you require the 2 phenyl groups for this molecule to sit on the receptor properly to have agonist activity. And in place of the other phenyl group, you have an ethyl group. You can see that's an ethyl group. So, and of course, again, because of that, it has that carbon there. It has carbon there. You see, again, it borrows also. It borrows from methadone, in that you can still see it has from isomethadone rather, it has a beta alpha methyl group, and of course it has a tertiary terminal nitrogen, and therefore it has some structural similarity with the phenyl propyl amines, and of course also differences, especially in this area where you find that it has only one phenyl group, and of course also it lacks, remember, it also lacks in a ketone, because the other drugs here, they would have a ketone. So in place of the ketone, all alcohol as in the propoxyphene, it has a hydrogen. So it has those structural similarities and also structural differences. And because of the structural differences, then definitely we expect it to have differences in its activity. We can consider that position 1, position 2. So it has an 1R2R stereochemistry. It is a central reacting synthetic. It's completely synthetic narcotic analgesic. It has a dual mechanism of action. It's a mu receptor agonist as well as a noradrenaline reuptake inhibitor. So it can also have some stimulant activity and of course also analgesic activity. It has lower potency than morphine, but with more tolerable side effects. So of course, the structure of tapentadol is quite different from the structure of even methadone, and therefore you'd expect it to have much lower activity. This is just a summary which we have looked at. We had already looked at the receptor, and again we are reminding ourselves that if this is our narcotic analgesic, then we did mention a phenyl ring, and we have seen a phenyl ring in all the drugs is necessary for good activity. And the phenyl ring, again, through aromatic, hydrophobic interaction, we bind to the D site of the receptor. And then, of course, you have the other groups that also bring in lipophilicity or are hydrophobic in nature. Again, we interact with site C, which is also hydrophobic in nature, of importance. And we have seen this in all the drugs that we have looked at. Is the tertiary amine, which is protonable at physiological pH to give us a cation, which of course interacts with the anionic B site within the receptor. And for some of the drugs, as we have looked at the anilidopiperidines, they do have an extra binding site, or when the substituent, either they have further substitutions at a different point. Remember, like when we were looking at the buprenorphine, when we were looking at the etophins, there was etophins or thebanes. When we're looking at the thebanes, we say they had an extra substituent at position number 7, and that extra substituent at position number 7 also was binding the A site. Even when we were looking at the anilidopiperidines, we say it is tutored in such a manner that it binds all the various sites of the receptor, and therefore, depending on the structure of the molecule, it will interact with these receptor sites differently, and therefore give us differences in the analgesic activity. So I hope that's just again a refresher. We have looked at that in details for each and every class of drugs. This again is just a summary, which we are saying you can start with epoxy morphinan, which is morphine, and then you can convert it to different compounds. You remove E ring, you get the morphinan. Remove C rings, you get the benzomorphones. You remove removal of ring B, you get the anilidopiperidines, you get the phenylpiperidines, and then you remove ring D, and you get the phenylpropylamine. So this is just a summary of the various drugs. Of course, we did say do annihilation, whereby you add ring F and you get the olipavines or the thebanes or olipavines. And this is just a summary to show us you can indeed start with morphine, and there can be structural modification, one of the peripheral groups, or removal of some of the rings, and still have compounds that can bind to the receptor, some better, some lesser, and therefore get compounds with differences. We have different potencies in comparison with morphine. So that's just a summary. So the only other group, and we had said 1 or 2 points about, is the narcotic antagonists. And we had mentioned that the narcotic antagonists are synthesized or are designed by changing the substituent which is attached to the nitrogen at position 17 of of morphine. Once you change all of morphine derivatives, once you change that substituent, you make it either an allyl group, that's a CH2, CH double bond CH2, all a cyclopropane group, a cyclopropane methyl group, then you find the resultant compounds do have analgesic and narcotic and antagonist activity. But in order to maximize that activity, you find that those drugs also have other structural modifications within the periphery groups. In other words, you normally don't start with morphine. You structurally modify the morphine to get the morphine, and then now, or to get actually the oxymorphone, and then from the oxymorphone, now you structurally modify the group at position number 17. So we are saying there, for replacement of the potent narcotic agonist oxymorphone as an N-methyl group with either an added group, which is CH2, CH2, a methyl cyclopropyl group, or even a methyl cyclobutyl group, results in compounds that have analgesic and antagonist activity. So it results in the emergence of opiate receptor antagonist activity. Pia opiate antagonists that mu, kappa, and delta receptors include. So they have naloxone, naltrexone, nalmefene. The methyl cyclobutyl will also have some agonist activity. Therefore, it is not a pure antagonist. So pure one, naloxone hydroxide, naltrexone, and nalmefene. Pure antagonists are used for the reversal of narcotic respiratory depression induced by opiate agonists as well as psychomimetic actions. So the narcotic analgesics, antagonists, the narcotic antagonists, you use them when people have taken too much of the opioids or the opiates or the opioid agonists to try and reverse the depression, because one of the things that these drugs will cause is that they will cause respiratory depression. But the only problem with some of this, they will still give you the withdrawal symptoms, and that is why we talked about using methadone, whereby you give these, especially at rehab centers, you give them methadone. Methadone will still give them the kick. But the advantage of methadone, when you give them methadone for some time, methadone does not have withdrawal symptoms. So when you give them methadone, they get used, of course, to the good things. But once you remove the drug, they do not have withdrawal symptoms. So they do not require to go back to the drug to get rid of those withdrawal symptoms. But when you give them these other drugs, they will still have the withdrawal symptoms, and therefore they will go back to the drug. So pure antagonists, so we have said these compounds are also used as adjuncts to the maintenance of an opiate-free state in detoxified, formerly opiate-dependent patients. So you also use them in rehab centers in addition, of course, to methadone. Naloxone is administered IV or IM. It has low oral bioavailability and also slow action. It has a relatively short half-life. It is this is not naltrexone. Naltrexone. You see, naloxone has low oral bioavailability, and that's why we use it either IV or IM. And then naltrexone has oral bioavailability. It has a substantially longer half-life than naloxone. It has a longer duration of action. Also, nalmefene is administered by injection. It also has a longer half-life and duration than naloxone. So naloxone is the one which has the shortest half-life. When you look at its structure, it's the one which has the allyl group. And if you look at the allyl group has a double bond, and the double bond gives drugs. It has a double bond, it has that alkyl group, and when you have alkyl groups, especially double bonds, you have high susceptibility of metabolism through oxidation. So because of its structure, I believe that is why you look. This is a structure of naloxone. So you can see, because of this double bond here, that double bond there, it has very high susceptibility to metabolism, and therefore it will have a short duration of action. Of course, also forgetting that's an alkyl group. So that's why we are saying it has the shortest duration of action, and of course has very poor oral bioavailability, because most probably it will undergo fast metabolism. Then, so that was the three drugs. Nalbuphine, of course, nalbuphine hydrochloride is a mixed opiate agonist antagonist. Nalbuphine, I don't know whether we have its structure. Yes, nalbuphine is where now we had said you have this group here. So you have the cyclobutyl methyl group. And the cyclobutyl methyl group, remember we did mention when you make the group very large to a particular size, again, the compound gets agonist activity. It is able to interact with the A receptors much better and therefore give us agonist activity. So nalbuphine is a mixed agonist antagonist because, of course, of this size, of the large, slightly larger size of that group, of the group at that position. Of course, when we talk about nalbuphine, of course, nalbuphine will have a hydroxyl group at position number 6. It is a fine, it's a morphine derivative. Unlike the others, other naloxone, naltrexone and naltrexone are derivatives of oxymorphone. And indeed, as we had said earlier, remember, we did mention once you do saturation, saturate the molecule there, and you oxidize the ketone, the hydroxyl group to a ketone, not only we did mention you change the structure, they haven't indicated here, of course, but we said you change the orientation of ring C from boat to chair. And once you change it from boat to chair, then you find that the ketone group does not interact with the hydrophobic group, which is available, and therefore it gives us better interaction with the receptor. So of course that change of there is a saturation and oxidation, and of course also for this drug to be an oxymorphone at position number 14, there is also addition of a hydroxyl group that again improves on the interaction of this compound at other sites of the receptor. So naloxone, naltrexone, both of them are oxymorphone derivatives, but with the substituent at position number 17 changing in one of them, it being a cyclopropyl methyl group, So we can see that is 4 carbons, whereas this is 1, 2, 3 carbons. And we had said between 3 and 5, then you can have antagonistic activity. Beyond that, then again, you can have both agonist and antagonist activity. Beyond now 5, then you also encourage agonist activity because of those molecules binding on the A receptor. So that is nalbuphine. I just wanted to look at that. It functions as a potent antagonist at the mu receptors and an agonist equipotent with morphine at the K and K3 receptors. Remember we said the K and K3 receptors are not as effective as the mu receptors in terms of agonist activity, but they can still bring us agonist activity. The antagonist action of the drug accounts for a ceiling effect on respiratory depression and a low abuse potential. What we are saying in ceiling is that there is a maximum drug, there is a maximum dose that will give you the maximum respiratory depression. And beyond that, even if you increase the dose, it will not continue depressing the respiratory system, and that is important. It also has low abuse potential, I believe, because of course also the antagonist activity. It is available in solution as an IM injection. It has the same time of onset as duration of action. Then you have nalbuphine, is known to undergo 3O glucuronidation and to a lesser extent N-dealkylation. The other compounds are presumed to be also metabolized the same. If you look at nalbuphine, remember we did mention that again you can replace the hydroxyl group or the ketone at position 6 with a methylene group. So nalbuphine has the methylene group there, giving it very, very good antagonist activity. All we are saying is that if you look at its metabolism, for its metabolism, it can undergo 3O glucuronic conjugation, just like the others, because they have a 3-hydroxyl group, and to a lesser extent N-dealkylation, just like the other compounds. Even the other compounds can undergo that kind of metabolism. So those are the main antagonists. And the main antagonists, as we have seen, they are antagonists because of the group that is put at position number 17. The other groups that are at the periphery of the four rings, those groups help to increase that activity, just like they will increase the agonist activity. There is one before I go to the there. I think that will be the end of. There was one compound I wanted us to mention. Pentadol we have mentioned. There was also another antagonist of the phenylpiperidines. Yes, we have alvimorphan. This is, you remember we did mention that for the phenylpiperidines, if you put the same groups as we have put for the morphine and analogs at position 17, we said you can't put an allyl group for you to get antagonist activity. You cannot put a methyl cyclopropane group to get an antagonist. But it was seen that on introduction of this very huge group here, it's a very huge group, to give us alfimorphan. So I think some books don't put the H, they call it alfimopan. So this group is very different from the groups that we have seen in the other narcotic antagonists. But as we had said, for the phenylpiperidines, you cannot put those groups as we have put in the morphine analogs to get antagonistic activity. But this was a compound which was found to have antagonist activity, but it was very, very specific for the receptors within the GIT. Very specific for the receptors in the GIT. So alfimopan is a peripheral acting mu opioid receptor antagonist. It binds the GI mu receptor strongly, but dissociates slowly, exhibits selective peripheral activity. It has very limited CNS activity. It works by protecting the bowel from constipation effects of opioids, medications that are used to treat pain after surgery. So all we are saying, because it's an antagonist, remember one of the major side effects of opioids is constipation. And the advantage of this drug, it is that it's very selective for the GIT receptors. And when it binds the GIT receptors, it brings about antagonist activity. And of course, it has antagonist activity because when it binds family, dissociates very slowly, and does not have agonist activity. So you see, it binds family, dissociates slowly, but does not trigger analgesic activity. And therefore, remember, antagonist activity is a molecule which will sit on the same receptor and not trigger agonist activity. So that's what we are saying. When it binds, it will bind those receptors, it will bind the mu receptors, and as it binds them, it will not trigger any agonist activity. It will block them from being accessed by the proper agonist, and therefore bring us antagonist activity. And we are saying when that happens, it mainly happens in the GIT, and therefore you can use this drug for patients who have had surgery and required to get the narcotic analgesics. And since they might have constipation, you can give them this on recovery so that they do not have any constipation. And that is the only compound I think I had left out. We have now covered, or I think we are done now. As I said, learning is continuous. For sure, you can never do everything. If you have to do everything, then you will do that topic for a whole year and perhaps not finished. So